Okay, Miss Mallory. So this is your asthma action plan. So your asthma triggers are pollen, dust mites, smoke, and air pollution. You are vaccinated and up to date. So as far as your green zone and medications that you should, that you can keep it under control and you're doing well, you're breathing good, those would include Symbicort, which is a butadiene, and formoterol. Those are two puffs with a spacer twice daily. And then you will also have a Spiriva Respimat. It's tiotropium is a medication that's in there, and that as well is two puffs, but it's only once a day. Now, for your smart and like your quick relief, you will use your formoterol, your Symbicort, 1 to 2 puffs. Max is 12 puffs daily. And also, you can use it as a quick relief if you have exercise induced asthma. If your symptoms continue, you can drop into the yellow zone. And then those problems consist of cough, wheezing, tightness in the chest, problems working or playing, or waking up at night constantly. So for that, as far as quick relief, you'll have an albuterol MDI, and you can do 2 to 4 puffs with the spacer every 20 minutes for up to an hour. But you will also continue your Symbicort and your Spiriva, just like normal, uh, but you will just add the albuterol MDI. Um, and then if you need that extra rescue kind of like medication to give you that relief, then you will add your Symbicort as well. And that'll be 1 to 2 puffs every 4 to 6 hours if needed. But just remember your 12 puffs daily is your max for your Symbicort. You can't take more than that. Your symptoms should gradually progress and get better within 20 to 60 minutes. If they do not, then you will drop into your red zone, which is very, very critical. It has a lot of problems breathing. You cannot work or play, getting worse instead of better. Medicine is not helping, and you just feel very, very sick and drained. So, for that one, we will have an albuterol 4 to 8 puffs with a spacer, or it could be a nebulized albuterol, and it's 5 milligrams. You will also add an ipratropium and albuterol nebulizer every 20 minutes, and you can do that 3 times. If your symptoms do not get better within 15 minutes, either you will have to go into the ER or call 911, just because it is very severe and you can go into respiratory distress. Okay, on this slide, I just kind of wanted to touch base with you on what a peak flow meter is and then your zones, and just kind of specify what kind of things happens in each one of your zones, your green, yellow, and red. So on the left are examples of peak flow meters, and basically you will blow into it for you will do 3 times, and your best score on the third time, that will be your like most accurate number. So to be categorized in the green zone, you would have to be within 80 to 100% of your personal best. And that just means that your breathing is good, you don't have any warning signs or asthma symptoms, you're taking all your medication as prescribed, and then you're taking an inhaler prescribed if you need it for exercise induced asthma. In the yellow, that's kind of like caution. You're kind of starting to get a little bit more sick. That's between 60 to 80% of your personal best. You're runny, you have a runny, stuffy nose. You're sneezing, you're coughing. Your chin or throat might itch a little. You feel a little restless. You're feeling a little bit more tired than normal. Dark circles under your eyes because you're not sleeping well. So at this point in the yellow zone, you will use your rescue medicine, and then you will repeat your peak flow after 20 to 30 minutes after your rescue medicine to just kind of make sure that it is improving and not getting worse. You might want to call your doctor or your healthcare professional if your peak flow is not back in the green zone. If your peak flow drops more into your yellow zone or in less than 4 hours, you just kind of want to call your doctor and be like, I think there's something wrong. Now, if you are in the red zone, which is the danger zone, that is below your 60% of your personal best. You are constantly coughing more at night, wheezing, tightness in your chest, or your chest hurts, breathing faster than normal, shortness of breath. You use a quick relief medicine by inhaler or nebulizer right away, just as we discussed in your asthma action plan. You will go down kind of like the steps of each medication that you would use to try to kind of get it under control and start going back into the green zone. Um, and if nothing works, then call your doctor or call 911 or go to the ER. Next, I wanted to talk to you about proper inhaler usage, especially using an MDI with a spacer. And then this is what a spacer looks like, and this is your inhaler. So basically, you are going to shake your inhaler for 10 seconds really, really thoroughly. And then you will take your inhaler, the cap off the inhaler, and then you will place it into your chamber, just like so. And then make sure some of the chambers have like little caps, some of them don't. So then you will take your cap off your spacer and just kind of face it towards you. You will blow out all the air and then put your lips around the mouthpiece and make a really good seal, a tight seal. And then the moment that you feel like you're going to have to start inhaling, that's when you activate your inhaler, and then you will be inhaling deeply and slowly. Um, and then once you get all that in, you will hold your breath for 10 seconds. Once that is done, you will complete your 1 to 2 puffs, depending on how much is prescribed for your medication. If it is a DPI, which is a dry powder inhaler, you will have to rinse your mouth out thoroughly so that you don't get thrush. If it's an MDI or a Respimat, which is like a mist, you don't have to rinse your mouth out with those, just with the DPI, just to prevent thrush from developing, which is very, very painful. So here I just wanted to kind of touch base with you and then kind of explain the differences between an MDI and a DPI. An MDI is a meter dosed inhaler. It is an inhaler that uses a pressurized propellant. It requires slow, coordinated, deep breaths. MDIs require high coordination, hand lung coordination, just to make sure that you have it, close to your mouth, and then that you're inhaling at the exact same time that you actuate it. It can be used with spacers, which makes it better for patients with poor inspiratory flow, children, and the elderly. Advantages of MDIs: it can be used with a spacer to improve delivery, effective for patients with low inspiratory flow, and it's just a low cost inhaler. And then a DPI is a dry powder inhaler. This is an inhaler that is breath actuated, so the user's breath triggers and delivers the powder. Um, a DPI require low coordination, making them often easier to use. DPIs are better for those who struggle with coordination. DPI advantages is that they are breath actuated, no hand breath coordination needed. There's no propellant, so there's less impact on the environment, and then easier to use for many patients. So DPIs have like little blister packets. And so when you kind of actuate it, it kind of bursts the little blister packet. So when the patient goes into inhale, which is that inspiratory flow, when they go and suck in, that is when they're sucking in the medication into their lungs, and then they just hold their mouth, which is why for DPIs, we encourage patients to rinse their mouths, just because that powder kind of can sit in their on their tongue or just anywhere in their mouth, and cause thrush, which is why you rinse your mouth with a DPI. Okay, so other asthma medications that are used for patients with asthma, we have long-term control medications, which will be like your daily use to kind of keep yourself in that green zone. So these medications reduce inflammation, they relax your muscles, and prevent asthma attacks. So for these, we have inhaled corticosteroids. Most common are like Flovent, Pulmicort, and Asthma-X. Your combination inhalers are your inhaled corticosteroids combined with the long-acting beta agonists, your LABAs, such as Advair, which has fluticasone and salmeterol, or Symbicort, which has budesonide and formoterol, which Symbicort is the one that you are on. So that is your combination inhaler. Leukotriene fires are oral pills. Those include your Singular and your Montelukast that reduce airway inflammation, your long-acting muscarinics antagonists, which is your LAMAs. Those are long-acting bronchodilators often used with your inhaled corticosteroids, for example, Spiriva. And then we have theophylline, which is a daily pill that keeps airways open. For your quick relief, which is like your yellow zone when you're starting to get a little bit worse, used for rapid relief during symptoms or an attack. Those include your short acting beta agonists. They relax your airway muscles within minutes. For example, your albuterol, your pro air, or your Ventolin. Anticholinergics are used if your SABAs are not tolerated, such as ipratropium, which is Atrovent. Oral corticosteroids are used temporarily for severe asthma attacks, which is like a prednisone. And then other treatments, these treatments are like if we've maxed out all um, all other options, like none of the quick relief medications are kind of keeping you under control. Your long term daily medications are still not keeping your symptoms at bay, and giving you more better days and more bad days. So then we will start kind of trying to go into a biologic. A biologic is a medication that is injected, which is for very severe uncontrolled asthma. Those are Xolair, so it's omalizumab, Farenra, it's benzolinrab, and Dupixent. Dupixent is the most common one that you hear people with severe asthma. And then there's other allergy medications like antihistamines or immunotherapy if allergy triggers asthmas. Okay, so I just wanted to take a minute and review your asthma questionnaire. So, in question one, during the last 4 weeks, how much of the time has your asthma kept you from getting as much done at work or school or home? And you have responded some of the time. Question two, during the last 4 weeks, how often have you had shortness of breath? And you've answered 3 to 6 times. During the last 4 weeks, how often has your asthma symptoms, wheezing, coughing, shortness of breath, chest tightness, or pain woken you up at night or earlier than usual in the morning? And you responded 2 to 3 nights a week. During the last 4 weeks, how often have you used your rescue inhaler or nebulizer medication, such as your salbutamol? And you responded 2 to 3 times per week. And then, how would you rate your asthma control during the last 4 weeks? And then you said somewhat controlled. So basically, your asthma is not under control. You feel like you're constantly having to kind of dip into the yellow zone. So we will try to adjust a couple things and then hopefully make you feel better.